So good morning, everyone. Good morning. So today in this session, me and our Deepti will continue with the yesterday's talk on INICET paper. So we'll try to again give you some ideas about the exam, and I will start today with the first message about INICET paper. It is not only about the topics and the subjects; it is also about how you do the exam. One of the most basic things that all the high achievers know in the INICET paper is, can you tell me what is it? What is that most basic idea of the skill? That idea is that you need to score more marks than other by attempting more. It is very important. That I have seen over the years, and I'm sure you would also agree, that if you attempt two less, suppose you attempt out of 200 only 160, then still you will get some mistakes and your net score will be much lower than a rank one who will be scoring 175, 180 correct. And so if we know by now, and it is very important realization to understand, people who are topping the INICET paper are getting 175, 180 correct. So to get that kind of correct, you have to attempt 190 plus so that you 10, 15 you will get wrong and you get to that zone. It is not like that you will guess and say inky pinky ponky po reach to that level. But you have to have that aggressive mode. And I will elaborate this aggressive mode more. But let me ask Dr. Deepti now. Dr. Deepti, yesterday we discussed more about the pre and paraclinical, which form the 50% of the paper. Remaining 50% of the paper predominantly is contributed by the larger clinical subjects. What is your suggestions on that?
Well, I
All
think
most
the
important.
yes, the large subjects, as the name suggests, they are large. So I'm just going to say that, what we are talking about are topics that must be revised close to the exam, right? So rest, yes, the examiners know the best, but some things we feel that these must be revised. So especially, when I talk about obs and gynae or the big clinical subjects, I would say they've been consistently asking questions on primary amenorrhea, so ensure that you know that, right? Cervical cancer. So, instead of the cancer, they're now focusing on, the virus, the screening protocols, the vaccine, right? Then again, in OBS, consistently something or the other keeps coming from fetal monitoring, basic antenatal care, right? And yes, instrumental delivery is currently the hot topic. Preeclampsia, ectopic, right? Abortions, they do always have a representation in the paper, right? So prolapse surgery. So these are like the most important ones. Then if we keep talking about the big subjects, and I'm sure Dr. Sumay, you would agree that we cannot leave diabetes and tuberculosis, right? So diabetes ka
HIV
management,
as well.
tuberculosis. What would you want to say?
HIV as well.
Yes, we included that in microbiology yesterday. So from the viruses, right? So absolutely yes. Then they've been consistently asking. I'm sure Dr. Sumer would let us know more about it. Stroke and its management basics, right? So
Especially, with an image-based clinical question where they put stroke, head injury. This is a very important part of the INICET exam. Stroke is one of the most important topics that I would want all of you to keep in mind. In addition to that, all the pneumos are always important. Pneumothorax, pneumoperitoneum, pneumocephalus. Remember last time they had this Mount Fuji sign. So, there are integrated questions where there will be a radiological image, but the question might be surgery or medicine based.
the criteria are again something that they ask, like the infective endocarditis criteria. So such certain specific surgical criteria, right? Hypertension. You do have a representation of these. And then again, when we discuss this, we always know the general surgery is important. So basically, shocks, all types of shock and their fluid management, burns, right? So again, burn ka calculation and the formulas that we use there. So Dr. Sumit, you want to add something to that?
Not only that, I think if we see a disease which is there in all subjects, like cystic fibrosis, always ask. Cystic fibrosis is always an important topic for any set.
Yes. So similarly, also definitely revise the colorectal cancers, the left and the right sides. They're anyways the emerging cancers and they're likely to be asked. Thyroid cancer and surgery again, whether they integrated with nerve injuries like recurrent laryngeal nerve injury or something or the other of that kind, they are going to those areas. So those are like the key things from the big clinical subjects.
And also, it is important to understand that the paper is going to be primarily formed from your basic sciences, bigger clinical subjects, medicine, surgery, obs gynae, PSM, then layered up by of the ENT, then by the short subjects. And that is why we are more stressing on this zone of the paper. And also, what I would also tell you that when I say aggressive mode, what does that mean? Suppose in the first go in the paper, although the paper is now going to be in the blocks. So, you have to see whatever I'm telling you, you have to imagine it block wise. Suppose you do the first block of 50 questions and you're only able to do 25. Rest of the 25, there are 15 questions where you are unsure of the answer, but you know the concept. You know it, but you're unsure of the answer. There are 10 questions where you are like five you have no idea about, five you have like some idea about. So so try to understand. Out of the 50 questions, half of the questions you are sure of the answer, you've done it. But if you do only those, you will not get through the INICET paper. Even after the first block, you will be over because you will be leaving 25 questions. And people who attempt 175 questions don't make through the INICET paper. You have to be very clear that now you have to focus on the those 15 questions where you are unsure of. You have to find out, although I am unsure of, what is my gut feeling telling me, what is my logic telling me, and you have to tilt the balance and get the answer there. You have to make that 25 to 40. The toppers even capture the remaining five. They capture the remaining five also, where they had some idea, not unsurety, but some idea only. They try to use that some idea to eliminate options. Then they take the educated guess. It is very important that, like, try to understand. For 25 questions where you had full idea, you went ahead with your first instinct. Next 15 question, you use the elimination and the logic. Next five questions you will use more elimination, less logic, because you have no idea about. But five questions where you have no idea about, you might leave it. But usually in a paper like INICET, 50 questions, four block, every block you have to leave less than five. Actually, if you leave five also, it is too much, because then in four blocks it will become 20, and then your attempting will become 180. The moral of the story is, try to target leaving 2 to 3 questions per block. That should be the maximum that you're looking at, because there will be questions that you may not know in the fourth block. अगर पहले में ही आपने 10 छोड़ दिए और जगह ही नहीं बची ना फोर्थ ब्लॉक के लिए, so 2 to 3 should be in your mind, and that will make you more aggressive in your approach. That will make you reach to the level where the toppers are.
Absolutely, yes. And when we are talking about educated guess, me and Dr. Sumer have always highlighted, if it is a question where you have ideas and you're getting confused between two options, it is usually better to go with your first instinct, right? Because when you tend to overthink, you tend to change answers. Second, when it's a clinical vignette, then yes, you need to put in a little thinking, right? And then the idea is identify keywords. Usually, every line will have one keyword. Pick up those keywords, focus on the last line, and then decide which one is a better answer, right?
And
So,
so in a paper like INICET, you start the question by an assumption that I know the answer, or you start by betting on yourself by saying, I'll be able to find out the answer, I'll be able to create the answer. And you try your best to, like Dr. Deep said, find the keyword, find the wrong option, use the instinct, use the logic, remove some choices, then attack. In this exam, if you go defensive, especially in the central institutes, because the seats are lesser than what you see in the NEET PG exam. So now what happens is that, suppose you get a 10,000 rank, it may get you a PG in your NEET PG exam, but not in the INICET exam. So I have to be more aggressive because I have to win big. So that is one mantra that all the toppers know, and you will see after the exams are done, and when I will be interviewing the toppers on this channel, I will ask all of them that how many did you attempt, and you can see it in the last time also, and you can see multiple such videos for last 20 years on the channel. You will see all of them will say we were 190 plus, 195 plus. It is important to attack the exam to win big in this exam. Second thing is that if you are, sometimes you will say, sir मैं तो करता हूँ, मेरे से तो गलत हो जाते हैं, सर मेरे से तो नहीं हो पा रहा. So नहीं हो पा रहा तो ठीक करते हैं ना. It is important that you have to titrate your skill and find what is working for you, what is not working for you in the grand tests. Grand test, INICET mocks, INICET CBT, DAM CBT. I think on third we are doing the NEET PG CBT, and I would request that attempt as many papers with your attacking mode, defensive mode, titrate. Find out if I go over, कुछ लोगों के लिए होता है कि मैं ज्यादा एग्रेसिव हो गया तो गलत हो जाता है, तो फिर थोड़ा कम कर ले. समझ पा रहे हैं? तो 191 पे रुक जा, 195 पे मत जा. But you have to titrate it for yourself. You have to find a way which works the best for you. How aggressive should I go to win it best?
Absolutely, yes. And another thing that some of the students are saying that if they want to practice more questions, should it be SWTs? Should it be INI mocks? So I would say go for INI mock papers. We have crafted various INI mock papers in your test series. They all come with difficult, or they all come with different difficulty levels. So some are going to be easy, some moderate, some on moderate to difficult side. But the best representation, overall has always been for the CBT. CBT, as I keep saying, is contributed by the teachers. So every faculty in their own department, in their own subject, is trying to put up all their, inputs, and then gives you what would be the most probable things. So the level of the real exam and your number of correct questions quite closely resembles the CBTs, right? But yes, I would say if you want to practice more questions, INI mocks are there in your test series. There are about 11 INI mocks, and try and give them. The one that we did, or currently it is running live. There is a free INI mock for everyone on the app. You can go to test series section. The test is live until 30th, right? So please give the test. It gives a good coverage. The level is not very difficult because I believe close to the exam, what students need to have is faith in what they have done so far. And it is very essential that we are in the right mind zone. But yet, the INI mock is going to be an eye opener, a confidence booster at the same time, and ensures that you are not missing out on the must know topics, right? So, PYQs, PYTs. Close to the exam, we need to have this insight that we're not losing out on any major chunk, that we should be knowing it is there. Okay.
In the final, 2 weeks before the exam or 3 weeks before the exam, whenever we're revising, our goal is not to revise everything, because if you revise
Yes.
everything, you can't do it
It's
in
not
a limited
possible,
amount of
right?
time. Your goal is to touch upon the high yield, frequently asked topics of that subject so that you feel more confident in the exam. The exam may not have that question, but you feel more confident that I have seen almost all subjects. That is where we will again recommend Mission INICET in your short courses, in your app, is a must do confidence booster. It covers all the important previous year topics that teachers have taught for INICET specifically. So we would again recommend that. If you have forgotten that, I think that's a very important thing to look at.
Absolutely, I couldn't agree more. So, Mission INI said, INI PYQ ka baab, both are going to give you a very good coverage for what you need for INICET. And then some people, students keep asking, ma'am, in the final week, can I do DVT? It's an absolute yes. DVT has an excellent coverage. It gives you depths also, and it gives you the width also wherever necessary. So yes, for the final lap, we would always say like DVT is the go-to resource because you can do it multiple times. Same holds true for Mission INI-CET. If you have seen it once, you will realize all your confusions are gone. जहाँ पे भी आपको discrepancy लग रहा था, that is no longer there, and you can quickly revise all 19 subjects through the Mission INI-CET.
And also, people who are getting good rank in your INICET paper are also managing their time better. Now, imagine suppose you have to think on the questions and you don't have time left. You will make a lot of mistakes and you will not get through the exam. To get through the exam, you need to have time. To get that time in the day of the exam, you have to learn the art of being decisive. Don't dilly dally too much on a question. Suppose there's a question where you think the answer is A, you've ruled out. Don't play it too much that I will mark it for review, I will come back to it later, and all those stuffs, because there will not be enough time to do so much of it. So don't mark too many for reviews in the central institutes. Be decisive, manage your time well. If you know the answer, do it fast. If you don't know anything about it, leave it fast. Move fast so that you are able to finish the paper on time, so that you have time left to think about it, to think about the questions that you want to look at. Because people who manage their time well are having the attacking mode in the paper, are getting through INICET with ace.
Right. And also, again, I'm going to highlight the importance. So, when we say go with your first instinct, it's not that you haven't seen the other options. Please don't do that. What we mean when we say you go with your first instinct is when you're stuck between two options. So, you've calculated the options. Now, you know A is obviously right, but B could also be right under certain circumstances. Right? For example, you think, okay, if this happens, if that happens, then even B is the answer. So this is where we are telling you go with your first instinct, which was with A because it was obviously right. So you need to understand that we are all going to make the educated guesses here. It's not simply about what my a superpower is telling me that A is the answer, right?
And not only you're not guessing, actually you feel that you're guessing. Actually what is happening is, because on the day of the exam they are creating a new language, it's a new environment, they are putting some tricks into the question choices, so you don't know it directly. But it is not that you don't know it, you know it. You have to somehow get what you know and apply what you know to get into what is asked in the question. So there is a bridge to be crossed here. It is important that यहाँ तक सबको पता है, पेपर में थोड़ा सा उसको ट्रिक कर रखा है, उसको ब्रिज करना है. And to do that, you have to think on the day of the exam. And you will see हर lecture में, I'm sure if you've attended our lectures, हर lecture में मैंने, डॉक्टर दीप्ति ने, सभी टीचर ने आपको बोला, हमें सोचना पड़ेगा पेपर वाले दिन, रटने से नहीं बनेगा, सोचना पड़ेगा, so that we bridge the gap. We bridge the gap. Okay. So try practicing this ability in the unknown question. I will today tell you. I see some bachas using INI-TND and Mission INI-CET. It's a very good combination, Anushka. Yeah, I see one bacha MS is saying, sir, I'm using Mission INI and live rapid revision. Perfect. That is also a very good combination. I want you all to do this today and let me know in my inbox. Whenever you see a unknown question in the grand test, don't leave it.
Yeah.
Try applying logic. That is how you build your mental muscle. Try applying logic कि यार इसको मुझे पता नहीं है, फिर इसको कैसे रूल आउट करना है. फिर आपने सोचना है कि यार ये चॉइस तो शायद पक्का ही नहीं है, कट इट आउट, improve your probability, then find the other choices. This ability to think on a question is very important, because we are all used to a low attention span. What is happening is you are all playing with the phones all day, playing with the Instagram, Blinkit, all those things. So you want very fast outcomes. So whenever you are given a tough problem, that mental muscle needs to be developed. How do you develop your muscles? By kind of lifting incremental weights. You don't lift the same amount of weight every time. You try to increase it. You challenge yourself. Similarly, you challenge your mental muscle. So by challenging yourself on a tough question, on a long questions during your GT, you will be able to replicate in the real exam.
Okay, so depending on how difficult the paper turns out to be, is it easy to moderate or moderate to difficult? But I would say, looking at the current pattern, you should try and score 155 correct. As Dr. Sumer said, toppers usually are reaching 170, sometimes 175 as well. So I think everyone should try and target 155 correct, because the closer you get to the goal, the better it's going to be. And if you cross it, yes, it keeps getting better. So
And also, I see this question many times. So it's a more theoretical question. How many should you get correct?
yeah.
It's like you have to get as many as possible correct, so it's like, will you hold your hand back अगर 155 हो गए, 156 करेक्ट नहीं करेगा क्या? जो आएगा करना पड़ेगा ना. So that mode I told you in the beginning of my video today is the key. The key is aggression. I want you to go on that aggressive mode in the paper. You know it. You've studied so hard. Don't go too defensive and destroy the exam. Go attacking. You do that attack, but you need to learn the attack in the grand test. If you do it for the first time in the exam, you will make a lot of silly mistakes. You learn how to eliminate options. You learn how to get the answer from the keywords. Attend your TNDs if you've not done them so far. Use the INI TND papers. Grand test, attack.
Absolutely, yes. And this is why, the video solutions always help you. So please look out for video solutions of CBTs and GTs. especially of the subjects that you are scoring low in, especially of the questions that you're doing wrong. Towards the end, it's very important that we keep learning from our mistakes, right? So that we don't repeat them. So each one of you should target that at least for your wrong questions, you will go through the video solutions. Believe me, they are really, really very, very productive. सारे CBT के video solutions सुनो, because you will understand that we are covering PYT, so it gives you a lot of edge as well in terms of revision.
So I think one student is saying, sir, as the exam is approaching, I'm feeling little anxious. Little anxious, Gaurav, is good. It is good. That means you value the outcome, you value the exam, you value your career. थोड़ा तो होगा ही ना. अगर तू बोलता ना कि मैं तो एकदम रिलैक्स हूँ, मुझे चिंता ही नहीं हो रही है, तो थोड़ी सी होनी भी चाहिए ना. So little anxious is good, too much anxious probably not good, but little is good because you value the outcome. One question I see is one bacha is saying, sir, how do I speed up revision? By focusing on high yield. Madhurima, I already told you, you cannot revise everything, but you need to revise the high yield. For INI-CET, revise your mission INI-CET. NEET PG, DVT. DVT works for both NEET PG and INI-CET. It works for both. एक बच्चा कह रहा है, should I rewatch my attempted TND videos? Uh, Maybe it's a good idea to start looking at those papers again. Papers always help. Papers
I would
always.
also, especially the test paper and the notes that you've made out of it. If you've seen the videos once, I would not really say कि आप दोबारा से बैठ के video देखो. But yes, go through the discussion paper, notes that we have done with you as a teacher and the test paper itself. मैं हमेशा बोलती हूँ डैम्स के टेस्ट पेपर में it's not just 75 MCQs in the TND. It is 75 into 4, because what we have been told by Dr. Sumer is each option has to be there for a reason, right? The students have to know how or in which circumstance the option will change to some other answer. So which means all those 4 options by themselves are MCQs. There is something important to know in them, right? So ensure that you are going through the paper again, going through the notes that you made out of it.
And finally, what I'll take the final query for day is what I saying is how to deal with anxiety in the last days. Anxiety is a human trait. Robots do not have anxiety. So become a robot. How will you become a robot in the last day? By having a rituals. Now I'll tell you it's very easy to understand, but many people don't practice it. Under high stress situation, things that you have been totally trained as a robot since your childhood, like this is the time I eat my lunch, this, so they you keep continuing them at spinal level. Any other thing starts getting affected. So you become a robot in your studies also, that this is my time for MCQ, this is my time for grand test, this is my time for notes revision, and you follow it every single day. Here onwards, whatever may going on in your head, whatever may be going on in your life, you keep doing it like a robot. So you make a disciplined approach and you make it like, you will see a lot of toppers who say हर रोज इतने बजे से इतने बजे मैं एमसीक्यू कर रहा था, इतने बजे से इतने बजे मैं नोट्स कर रहा था, इतने बजे से इतने बजे तक मैं टेस्ट दे रहा था, and it becomes like a spinal habit. Habit is like very deep into our system. Habit is not something like you don't have to think about breathing or heart beating or your digestive system moving. Similarly, habits, you have a habit, you will pursue it. Like you will see many people had develop a habit of going for a walk at 6 o'clock in the morning. If it is 6:05, they get anxious. Even if everything is going wrong in their life, at 6 o'clock they will still go for a walk. They develop a habit. So then the anxiety is not there because it's a habit that you're pursuing. Make study your habit. Make giving grand test a habit. Okay. So don't make it a work. वर्क तो एंजाइटी में पूरा खराब हो जाता है. जब एंजाइटी सिचुएशन आती है ना, पूरा वर्क खराब हो जाएगा, लेकिन हैबिट कभी खराब नहीं.
Okay, we'll take up the last 2 queries quickly. Number 1, any score if you are stuck at, चाहे वो 130 हो, 140 हो, 150 हो, I've told you multiple times the only way to bring that up, because when you plateau, it means this is what your knowledge is so far, right? A plus minus a few here. But if you want to improve, you will have to see what you don't know. So please follow wrong diary, right? At least for your bottom 3 to 5 subjects, identify your mistakes and go back to your notes selectively for those specific topics. Second, is live rapid revision effective for these last days? Absolutely, yes. That's what it was made for, right? So please understand there is the sequence that we want you to follow. We want you to do one cycle of LRR. I have told this in the core strategy video as well. And then after LRR, we want you to go to DVT, right? And for the last, even for NEET PG, this is what we want you to do. LRR now, finish it up quickly, one round of revision, and then go to DVT videos. Or if you have attended the videos, your booklet, the two resources are amazing, right? There are different modes of revision as well. One is based on active recall, that's DVT. It helps you pick up the keywords, algorithms, next steps, images, everything. LRR is content oriented, but it is a very, very concise and crisp version of our own notes made by the faculty for you, right? So selectively, whatever you do wrong in DVT, you can come back to your LRR books as well.
And our goal always is to give you some ideas on how to prepare, how to study. And tomorrow, I think we will. What do you want us to talk tomorrow in the transform session? Any suggestions from your side?
So, till the time
So,
they're giving their suggestions, I'll answer Krishan's query. He's put it twice. For any set Mission INI or DBT, I would say if you haven't seen Mission INI-CT so far and you are targeting INI-CT, then not nice. Please go and see it. Mission INI-CT is a very specific course that we've crafted for INI-CET. So do that now, right? And it will automatically cover your PYTs as well.
and on this note, we wish you a great day ahead, a very happy morning. Go ahead and do it. Tell yourself, I'm meant for it. I am meant for it. I'm good enough for Central Institutes. Don't be fooled by world telling you that you're not good enough. You're good enough. लेकिन कोई और आएगा नहीं, अपना टाइम अपन खुद ही लाएगा.
Absolutely, yes. So go make the day productive and ensure that you get better by the end of the day. So, all the best, everyone. Have a great day ahead.